That really depends on the different circumstances of each nurse. Sometimes it can take just a couple of days between having an interview, getting a contract out and the nurse signing. Other times it can take a matter of months. So it really depends on each individual nurse's circumstance. The hospital interview varies between Skype and a phone call. That might just be voice or it could be a video call. It'll be a mixture of clinical and personality questions, but we definitely help each nurse prepare. So before the interview we send out a document which outlines some questions that are likely to be asked so the nurse can prepare for them, as well as information specific to the hospital so the nurse knows exactly what they're going into.
Once you've secured a job with our nursing team, they will forward your file to myself and I will contact you and retrieve information from you such as your family history, get copies of your passports, birth certificates, marriage certificates, and help assist with the coordination of your application for a 457 visa. And what that means is you'll be sponsored by your employer. I will lodge it on your behalf and also attach all the required documentation and liaise with immigration on your behalf until a decision is made.
Once you've signed your contract, I get notified and then I get in touch and introduce myself and then start to find out what it is that's really important to you about relocating, whether it's schools that you're really worried about, whether it's finding a rental property, anything like that. I get to know and then I can help you accordingly. We always have someone waiting for you at the airport, so you've got a nice friendly face to take you to your accommodation. We can also help with things like your first nights of accommodation if you haven't got something sorted. And then just helping you coordinate the whole relocation. So right from the very start to getting things organised like bank accounts, your APRA registration if that needs to be finalised, setting up, finding schools, all of that kind of thing I'll take care of and help you with.
We do find it easier when a nurse provides one reference. We understand that it's difficult if your current employer isn't aware you're leaving yet. So a previous reference from a past employer is absolutely fine, but before we go down the path of finding you a contract, we will need current references.
I'll be in contact constantly. I like to make sure that you're settled completely. From things like helping you to find the right school, the right fit for your kids if you've got children, to finding the right sports club or the right tea. If you're used to the tea from the Irish tea, I'll help you find that. One thing that a lot of people worry about is getting a rental property, and the rental property market can be tricky to get into, but with lots of advice, lots of support and help with references, you'll be fine.
Public and private hospitals can be quite similar depending on the area of specialty you work in. Obviously, public hospitals will be a lot larger. Most of them have large emergency departments, so you'll see a lot more trauma come through public hospitals. Saying that, private hospitals, some of the larger ones do have emergency departments as well. In terms of benefits, they're fairly similar between both hospitals. They both follow the award in most states, so salary will be the same. Depending on which specialty you work in will depend on whether there's big differences. Within Australia, nursing salaries are based on award states. Each state in Australia has their own nursing award, and your salary will be based depending on your years of experience. When coming in from overseas, you will need to provide statements of service to prove how many years of experience you have as a registered nurse. Of course your family can come with you. That's one of the best things about coming to Australia to work as a nurse. You'll be able to bring your partner, your children with you when you first start. Some nurses prefer to come out on their own at the beginning and then bring their family at a later date, but they are most welcome. When we first have a screening interview with you, we will send you a welcome email requesting certain documents. The first one will be your passport as a proof of ID, your nursing degree, diploma, certificate, any postgraduate qualifications, and of course your APRA registration. Plexus recruits nurses into all of the Australian states and territories and New Zealand. When we first screen you, one of our questions is, where would you like to live and work? If you change your mind after your screening interview, let us know. That's easy. Once you've signed a contract with an employer in Australia or New Zealand, usually the contract will state a start date. Obviously this is dependent on your visa processing and your time for relocation. If you have committed to a start date and your visa is approved, generally the hospital would prefer you to start on that start date, but obviously there are circumstances which may delay your start date, which can be discussed between ourselves and the employer.